Have you gotten to a place where you've decided to be vulnerable enough to reach out for some mental health support, only to find a whole alphabet of letters that you just don't understand? Like, you know those letters mean something, but you don't know what they mean or what kind of therapist you should get. In this video, we're going to lay out exactly what those letters mean so that you can decide what kind of mental health provider is right for you. Let's get into it. So all mental health providers have to go through formal education and training through college, university, and the like. Not only do they do academic and book work, but they do internships and supervised clinical work throughout their education to make sure that they not only have the knowledge, but the skills and the practice to help treat people in the real world. Once a mental health provider has completed their formal college education and training, they must continue to get education through CEUs and supervised professional practice for several years and thousands of hours. The letters that you see behind a professional's name are called credentials. The provider holds the credentials to indicate their level of education, experience, and sometimes a special focus that they can provide treatment for. When a professional is very first licensed in their state, they have what is called a provisional or an associate's license. This indicates that they have graduated from college, they probably have at a minimum a master's degree, and they are still being supervised by a fully licensed professional or even a doctor. Some letters you might see by a provisional or associate professional have a lowercase p at the beginning of the letters, or they might have an A in the middle of them, such as a P, LMHP, or an LAC, which indicates a provisionally licensed mental health practitioner or a licensed associate counselor. Now, every state has different requirements, but the state that I'm in requires you to have 1,500 hours of face-to-face direct contact with clients while under supervision of a fully licensed therapist or a doctor. So once a professional has reached their required number of direct hours or the number of years of supervised service, they then can apply for and receive full licensure. Full licensure, you will see the letters after their name or their credentials will all be in capital letters. You won't see any more lowercase letters and you won't see any more associate designations. However, the letters vary. I mean, from my state to another state, we might call ourselves mental health practitioners. They might call us licensed counselors, certified counselors. The letters kind of change and the wording kind of changes. However, it all basically means the same thing, that a person has went through college education, they have been in internships, they have been supervised for thousands of hours or several years, and they have earned the experience and knowledge to be able to go out and practice without having any more required supervision. A mental health provider may choose to specialize in a specific area. And when they do that, they take extra college classes and they designate their client time to specific issues that they have a passion for helping with. Some of these things might include alcohol and drug counseling or marriage and family therapy. So when a professional has chosen to specialize in a specific field and they get special licensure in that field, it indicates to a person seeking those services like, hey, I have knowledge and experience above and beyond what is required to help because this is a passion of mine and I like helping with these issues. So if you are seeking a specialty service or you really want a provider who specializes in, let's say, marriage counseling or substance abuse counseling, you can look for licensures that have specific letters. So if you want a person with marriage and family, you might look for a MFT or LMFT, which stands for Licensed Marriage and Family Therapist. If you're searching for a substance use counselor, you might find a LADAC is what we call it, or LADC, which is Licensed Alcohol and Drug Counselor. For specialized licensure, there are specialized requirements, which include supervised time working with clients with that particular issue. So if you find a provider who has that lowercase p in front of their credentials, that indicates that they have completed their college education and they are licensed and they are under supervision for their required hours. In the state I'm in, If you want to do drug and alcohol counseling license specialty, then you have to have 2,000 hours working with specifically substance use and addiction issues. I would like to take a moment here to emphasize that whether or not a professional is provisionally licensed or fully licensed, they have the knowledge and education and some experience and are more than capable of helping someone with nearly any issue. If we find someone has an issue that is above our skill level or above our understanding, we feel like they would be better helped by a colleague or someone with a specialty, then we will refer that person to someone else. So if you're just confused or you don't know who to go see, I just want to give you some peace of mind that no matter who you choose to go start your services with, that person will be able to help you, or they will be able to help you find the person who can help you. Another area of mental health that can be kind of confusing is social work. So I think often when people hear social work, they think of like DHHS and caseworkers and the people who come in and remove children from their homes. But in the mental health field, we have what are called clinical social workers. And these professionals are able to provide mental health counseling as well as connect people to resources in their communities. So if you feel like you have a other need, whether it's financial, educational, daycare, food, any of those kinds of needs that aren't being met or that you're just struggling with, a social worker would really be a good person for you to connect with because they can help you find resources in your community to help you as well as provide therapy with you. Another area that gets pretty confusing when it comes to mental health is what is the difference between a psychologist and a psychiatrist? So both psychologists and psychiatrists have earned a doctoral degree in their formal college education. So they are doctor. When it comes to psychologists, you might see PSYD or PhD. A PSYD or a PsyD is different from a PhD in the type of area that they focused on when they were completing their doctorate's degree. So a PsyD is very much clinically focused, which means a lot of their time while in college and internship and doing their thesis and research was really devoted to client interaction and working with people. And with a PhD, the bigger focus was on research and the field and academia. Both degrees work with people, and both degrees are psychologists. It was just the area of focus and interest during the college years. Psychologists differ from a mental health therapist or a social worker in that they have more education because they have a doctorate's degree, whereas therapists and social workers usually have a master's degree. They have extra internship education, and they might be more focused on like how the brain works versus the social emotional stuff. They just have more of that education. They also have the ability to do more formal testing than a mental health provider can do in general. Psychologists often do like personality assessments, parenting assessments. They might do autism testing and screening, whereas a mental health therapist or a social worker with a master's level education doesn't do those things. A psychiatrist is a medical doctor. Professionals who have earned a doctorate's degree and are a psychiatrist are a medical doctor, and you might see MD or OD after their name, just as you would a primary care physician. The difference being that they took special education in the field of mental health during their doctoral program, and psychiatrists are who will be able to provide you with mental health medication management should that be something you're looking for in your treatment. Now, there are other professionals who can prescribe medications for medication management in the mental health world, but we're just talking about the doctors and therapists. Other professionals would be nurses, and so I'm not going to get all into that in this video. Psychologists do testing, psychiatrists do medication management. That's how I kind of tell them apart. So now that you have learned a whole new alphabet around mental health providers, I hope this video has helped you to determine the type of professional you'll be looking for and give you the confidence to know that we're here to help you and that just reaching out, we will get you connected with whomever is going to be best for you. And if you're located in Nebraska, I hope that you will look to blueelephantcounseling.com for your mental health needs. All right, guys, I'll see you in the next video.